I've suffered now for about 7 months with a varying level of sciatic pain, sciatica. Sciatica pain is whenever you've got a pinched nerve, so in other words, your spinal nerve going down your back is getting pinched or squeezed by one of the discs that's coming out of your spine, your spinal bone. And the pressure that it puts on there causes pain down your leg rather than in your back. For me, whenever I inflamed this problem, my foot was dead, pins and needles in the leg, my calf was in lots of pain, and pretty much on the outside of my leg was where it was hurt. Depending on where the pain is, you can actually decipher which disc in your back is the one that's damaged, or the one which is protruding out of its normal position. So you can certainly look online for sciatic pain, and if it's on like maybe the front of your thigh, that's a different disc than where it is if it's on the side of your foot. So again, your foot could be very sore, your knee could be very sore, but the actual problem is actually from your spine, from your back. And a lot of the doctors that you'll meet whenever you're trying to deal with this will tell you to do stretching, and not just stretching of the muscles, but stretching of the nerve. So they'll ask you to like bend your head forward to get the actual nerve to move up and down, which that's what the NHS in the UK advised me to do. They said try and kick your leg out straight and move your head up and down to stretch the nerve. However, I don't think that's a good idea at all. I think that's potentially worse, because what you're going to be doing is you're going to be rubbing your spinal nerve up and down against where it's getting squeezed. So that's not something I would recommend. If anybody's saying that they've got sciatic pain, I would actually advise not stretching it. I would wait until the pain is eased and then try and do some stretching. But if you're actually suffering from the pain, stretching the nerve, I suspect, for me, just caused it to be more painful. So be wary of some of the information that you get, depending on the type of sciatica and the extension of the pain that you are suffering from at the time. Additionally, you could be advised to use hot water bottles, or in some cases ice packs. Again, it'll depend on where your sciatic pain is and how your body reacts to the certain stimuli that you get. I use hot water bottles and my back got worse. I then use ice packs. However, you've got to remember, whenever you're using these ice packs, they are not reducing swelling of some sort which you can see. It's not like, oh, you hit your shoulder and you've got a bruise or something. This is deep within your back, underneath muscle fibers, underneath bone, underneath the nerve, and then you get to your actual spinal column where it's protruding. So you're never actually going to decrease the swelling, but what you can do is you can decrease the signals of the pain up to your brain, and that's where ice packs can help, and also potentially the ice packs can reduce the blood flow to that area, potentially reducing the sensation of pain, but not necessarily the actual cause of it in the end. So that's something, again, some of the advice that you'll be given may just reduce the symptoms of the pain rather than the actual cause. So you won't reduce the swelling as if you'd hurt your arm, or reduce the bruising or anything like that. That can't be done because it's an internal injury deep within the back. Additionally, there are a lot of further stretches and exercises which you'll be given by physios later on, which are good for stretching the piriformis, and generally your muscles in your butt, or deep within your butt, because sometimes, a lot of the time, sciatic pain is caused by tight muscles within your either your upper leg, your butt, or your lower back, causing tension within your spine, or within the nerve, or rubbing against the nerve as well. So it may not actually be from the spine, it may be from a tight muscle or a tight tendon within your kind of hip joint that could be causing the problem as well. So again, a lot of the time the information you'll be given is just, oh, just stretch it off, work it off, go for some walks and all that kind of stuff. The different types of sciatica can be diagnosed depending on whether your sciatic pain is worse whenever you're sitting down compared to when you're walking, whenever you're lying down, whether it's in the morning, whether it's in the evening, whether it deals with heat, whether it deals with cold. So there's a whole pile of different, like, that's where going to a back specialist is really far more important than going to see your general practitioner. The general practitioner will go, take some painkillers and have a few days off. And generally the medical advice is that, yeah, usually it clears itself up within anywhere between 2 weeks and 8 weeks. And if after 8 weeks your back is absolutely fine, you're absolutely fine. You don't need to worry about it. However, in my case, I'm up to 7 months now, and I know I'm not fixed. My symptoms have massively died down, which is great, so I'm able to go to work. I was fully bedbound. I couldn't even sit in a chair at the dinner table, because sitting for any more than 20 seconds was causing excruciating pain, and it was so painful that whenever I was lying down, I had to lie face down in the bed, and it would still be waking me up multiple times during the night, where I'd be taking maximum painkillers, which after about 6 months I found I had a slight addiction to, and whenever, well, I don't know if it was called an addiction, but I did certainly have painful withdrawal symptoms whenever I decided to stop taking them consistently. There's 3 different types of specialists you can go to. You can go to a chiropractor, who is the person that can crack all your back and all your muscles and all that kind of stuff. There's an osteopath who does more stuff with like acupuncture, or maybe some micro adjustments or micro movements and all that kind of stuff, and potentially a bit of chiropractic. And then you can also go see a physio, who will give you types of exercises, type of stretches to do with that. If you can get somebody who is skilled in all 3 of those bases, then you are in a winner, and you can pay him as much money as you possibly can. Generally, when my back was horrific, the first person I went to was a chiropractor. First time I'd ever been to a chiropractor. I was skeptical of going there, and I was very nervous, thinking that the amount of pain that I was in, my opinion was that this chiropractor probably wouldn't actually do any work on me and tell me to wait until my pain had died down. However, that wasn't the case. They cracked me, like properly cracked me, which was quite surprising at the time. However, the cracking caused no pain. It didn't inflame anything, and there was a release of pressure within my back whenever that happened. It wasn't just the lower back that I cracked, it was the upper back and around the neck and all that kind of places. And they go into depth about how the pain and the cause may be down at one point, but it may be aggravated by other tensions and tightnesses within the back in other places, and also around the ankles and the knees and all that kind of stuff. So although it may be your leg that's sore, they may be cracking your neck. It's not totally intuitive. However, the chiropractor, I had no problem, did no damage, was a little bit expensive, around about £35 for what was about a 20-minute session. Went a couple of times, and the great thing was, after I'd been cracked, I was able to walk for a good about 20 minutes that day, and then the pains came back the next day, because my back was totally banjoed. After that, my back flared up again, like a week later. When I say flared up, it went from a category 10 of I can't even sit in a car to a category 8 of going, I can almost stand on this leg. Then flaring up again means going back up to category 9 area. So I went to an osteopath who did some acupuncture, electro-acupuncture, and some micro adjustments. Again, even more expensive, around about £45–50 for what worked out to be around about a 15-minute session each time, and I didn't get much relief or anything from that. It was a real case of maybe something would happen after about five visits, but I didn't have much success. My body didn't react to the adjustments that he was giving me at the time. However, the osteopath that I had did give me good advice about how to deal with my doctor and progressing the diagnosis of the injury further in regarding to getting an MRI scan, root contact and all that kind of stuff. So there was benefits to going to the one which I went to. However, there weren't physical benefits, there were more procedural benefits I got. And then finally I went to a physio who was skilled in all 3 disciplines, and was able to do both chiropractic, osteopathy, and gave me loads of advice regarding exercises and stretches and muscle tensions and muscle strengths, and even, like, you know, for my job I carry a camera bag, so like, do I carry it on the side where my pain is more, or do I carry it on the side that's the other side? Because if I have it on both, that will probably cause pain. But should I try and counterbalance, or should I uncounterbalance? There's quite a lot of information to try and figure out what would be best for the situation, and the physio I had for that gave me a lot of good information regarding that kind of stuff. But again, that'll be different for every single person. It's not something that can be diagnosed over the internet or over Facebook kind of thing. However, this is me up to 7 months now. The pain, the symptoms have massively died down. However, there is still, like, just sitting here, my leg is incredibly sore, and the pain is actually more in the kind of hip joint area going down into the thigh, and it's actually just on the outside of my foot at the moment. It changes from day to day depending on whether I have a good night's sleep or what I had done the day before. For these 7 months, I've been doing physio in terms of stretching, lying on my back, using the foam roller, using what they call a peanut, 2 tennis balls and some tape to crack the back, to open it up, to bring some relief off that, and also not just off the joint but also off the muscles that are used to hold the spine in place. But generally I've done no exercise, so no weight training, no weightlifting, no bench press. I've barely been able to do any walking or jogging. It's only really in the last month I've started to be able to do some walking again. Whenever I was at my worst, I was bedbound. Whenever it died down, I was able to walk exactly 600 meters until the pain got too much and I had to kind of pretty much lie down in the middle of the park until symptoms had died down for a little bit, and then I would crawl back to the house. So that was the kind of scale of that my leg was completely dead, it was total agony, and I couldn't actually walk more than 600 meters. Now, whether it means that the bulge from my disc is slightly moved and it's not pushing on the spine quite as much, I suspect that may be the case. However, the bulge is still there because I feel if I try to do a jog or if I try and climb upstairs too much, I can feel the pressure in exactly the area of my back, and actually it kind of radiates down the leg as well. I think that's a term that they'd use. Where does the pain go? Where does it radiate? It radiates down the leg, down into the calf and all that kind of stuff. And I've still got weakness in my left leg, especially in the foot and the ankle area. So just now, it's 3 months until I am scheduled to go get the back surgery. The back surgery that I'll be getting is a microdiscectomy or microdiscectomy. I'm not quite sure exactly how they pronounce it. But effectively they cut into the back, they remove a bit of the bone which covers the area, they move the spinal cord to the side, and then they take out the scar tissue or the gunk that's coming out of the disc that's in between the spine bones. And that should both relieve pressure and hopefully mean that I'm able to go back to normal living, to normal exercise. I'm 31 years old, and before I was doing this, I was doing half marathons, running around hills, doing weightlifting and all that kind of stuff. For the last 7 months, I've been barely able to walk longer than 100 meters. So the whole plan is that, although just now sitting, I can talk, I'm not sweating in pain, and I'm able to do some work. I'm not able to work out, and I'm not able to live life like I was before I was able to do it. So for me, getting the surgery, although a little bit nerve-wracking, is something which I really, for both my life happiness and also dealing with the fact that I've got a brand new child who is getting heavier and heavier and heavier. I can't be a father that can't lift up their child or lifts up their child and then is bedbound for another kind of fortnight because the back is so sore and the leg is so sore because of the damage being further caused to the back. So I'm getting surgery done in about 3 weeks time, and I will give you an update of how that goes. The doctor which I've seen advised me there are some certain risks with it. There also just being in a hospital, there's risks of infection or swelling or bleeding and all that kind of stuff. However, the situation with my back and the quality of life which I have whenever the back flares up is so bad that I'm willing to take the risk of the potential dangers of having surgery inside a hospital. The potential benefits far outweigh the potential risks for me in my head at this moment. I would also advise that in some cases surgery doesn't work. I've had a friend who's recently had pretty much exactly the same surgery as I've had. They said it was great for 10 weeks, their back was fantastic, they're able to get back to lifting their 3 children that they had, and everything was good. However, it's blown out again. It's fallen out, and it looks like it's in an even worse situation than what it was before. Now, that's kind of a case of, well, that may be something that could have been made worse because of the surgery, hard to tell, or would it have happened, or would it have been worse anyway even without the surgery. So it's something you've got to kind of consider is, do you want to know that your back is still sore because you've not tried something, or do you want to just live with a sore back or a sore leg or a dead leg because you've not tried something? Did I just say that at the same time twice? Or because you have tried something? Yeah, you'd rather try something and know it's failed than not try something and just be a failure. in terms of suffering of pain. Not you as a person. You're not a failure person. So if any of you've got any questions regarding sciatica or the types of pain that you're suffering or the kind of timescales to be considering about this, feel free to drop a comment in the section down below, and I'll see what I can advise you with in terms of how I've dealt with my situation and how it is just now. But what I would say is the first thing to do is if you suddenly have a blowout of your back. For me, I was doing a squat. My back had been sore for about 6 months or something, and I went to the gym. I was like, I'm just going to do weights again, and I blew my back out, and I had to pretty much crawl out of the gym. However, I went to the gym the next day thinking, I will just work through this, and that's where it got even worse. So my first tip definitely would be try and be active. So try and do walking, but do not do anything more aggressive or that requires more exertion than walking around the park. So if you feel like, oh, your back is about to blow, just take a month out of whatever training that you're doing and just turn it into a month of going for walks. And if it gets too bad, then you can't help it. You are bedbound if it gets to the point where it's proper sciatica and it's all down your leg and you can't move. And then it's a case of going to the doctor and getting prescription strength painkillers to deal with it so you can actually sleep through the night. But if you can already sleep and it's just a little bit sore, I would advise walking 100% is the best treatment at the smaller symptoms of sciatica. But any questions you've got, feel free to drop them in the comment section down below or leave me a message. Cheers, bye bye.